started the conversation last month during Heart Month with Dr. Boyden. He is the Medical Director for Preventive Cardiology and Cardiac Rehabilitation at Corewell Health. And he's back to answer some of your questions. Thank you for being here with us, Doctor.
Thank you so much.
And before we get into those questions, just first talk about, what are some things you're noticing? Any trends lately?
Yeah, I would say not so much lately, but over the years, we're starting to see more people who are younger developing heart disease than we ever before. And I think a lot of that is due to kind of the obesity epidemic, people getting a little bit more sedentary, us getting more reliant on electronics rather than being more out and active. And so we're seeing people develop complications of being overweight, like high blood pressure, diabetes, cholesterol, high triglycerides, all of which affect cardiovascular risk.
Yeah, sitting is the new smoking.
100%.
Because
yeah.
we don't move.
No.
How do you distinguish, and I know people who have been through this on both ends of the spectrum. They have something and they're like, oh, it's just indigestion.
Yeah.
Or it seems like something relatively minor. Sometimes it is.
Yeah.
And sometimes it isn't. How do you make that determination?
Those things can be difficult to differentiate. I would tell you when things are more indigestion related, we have oftentimes food associations or timing with eating, and that can help us determine whether or not we think it's heart or something else. We also have to take into account everybody's risk factors, and if you're a healthy person and you have indigestion, it's unlikely that you're having heart troubles, but it's still possible. So we kind of have to tease that apart by conversation, probably a little bit of testing as well. People can have heart disease and not really have symptoms of it, so stress testing often isn't informative for us, because if you don't have blocked arteries enough to be positive on the stress test, we can miss it. But people with heart disease, whether it's even if it's not obstructive, could still have heart attacks. And so there are different ways for looking in different people based on what they're telling us and what that conversation is.
Another question here from a viewer. What is the current thinking about blood pressure? What is too high?
So a lot of the studies will tell you that anything over 130/80 puts you at higher risk of cardiovascular complications, and that doesn't mean just heart attack. You can develop heart failure from that, you can develop atrial fibrillation from that. That's an arrhythmia that increases risk of stroke. So we're trying in most cases to get people's blood pressure below 130/80 on average. If you looked at your pressure throughout the day, it goes up and down, and stress is certainly a big cause of blood pressure going up. But if the average blood pressure is less than 130/80, you're in good shape.
Is there a time of day when that blood pressure is lower?
Theoretically, for most people, it's lower when we sleep. And I say theoretically because there's a lot of sleep apnea. Just as I was talking about earlier with the obesity epidemic, we're seeing an increase in the amount of sleep apnea. And sleep apnea causes a drop in our oxygen levels when we're sleeping, and that can cause our blood vessels to constrict and cause the pressure to go up. So for some people, they actually have nocturnal hypertension, and that may be one cause for it.
Yeah, and in taking blood pressure, if possible, taking it at the same time every day is kind of helpful. It gives you kind of a baseline. I say that from some experience because I've recently been through some of that. And one of the questions I want to ask you and to illuminate for our viewers is that when you feel something and you start to chase down those problems, you just alluded to it, you may have something going on, but it may not show up in the standard stress, right?
Yeah.
There are a number of different tests, because I took them all, and it could sometimes it's one and done. You're like, yep, here's the problem, we know. But sometimes you have to look a little deeper. So if you think you have an issue, perseverance and patience are kind of a virtue, aren't they?
Yeah, and persistence. So I mean, if you think there's a problem, I think it's really important that you continue to press your healthcare provider to say,
be your own advocate.
Absolutely. Because, the testing that we do, no testing is foolproof. No matter what we do, we can miss things, they can be wrong for various reasons. So if you really feel like something's different for yourself, you have to be your best advocate, and you have to keep pursuing that.
Rick was persistent, I can tell you that. Rick, I do want to ask you a question. What are some changes you made in your life after your surgery?
Well, I think there's a moment when you make that promise to yourself that I'm going to change everything that I ever did. That's not realistic. So I've done the best to change some diet, more exercise for sure, and you try to limit stress. But just as a personal experience, I would invite everybody to try that because we live in a world,
Yeah.
right? And you're still going through
Yeah.
things every day. That's probably the toughest, but also to be mindful. And one of the things you do is try not to do all of the things you did before.
Yeah,
Yeah.
great points.
Yeah. Anything else that you want to add?
Yeah, I would tell you there's lots of different ways of going about this. You talked about stress testing. We can do certain things with CT scans, not only to detect heart disease, but detect it early before you develop symptoms. And that's a CT calcium screening. It's an inexpensive test that I really recommend for a lot of people. So you can identify coronary disease early, treat the impact of it so you don't develop symptoms, you don't need bypass surgery, you don't have heart attacks or strokes. And I think that's a really important thing.
Well,
Yeah.
Earlier is better.
Earlier is definitely better, but it's never too late either.
That's right.
Yeah.
all right. Yeah. Thank you so much for coming on and answering some of those questions. We appreciate it.
Thank you for having me.
Thank you.